Assalamualaikum and a very good day to everyone. So as I mentioned previously, I'm going to handle this lecture today via asynchronous teaching and learning, where you have to watch the video throughout, and there are going to be questions within this video that you need to answer before you can finish watching um, all the content in the video till the end. So as for today, I'm going to explain and discuss with you guys about exercise and the immune system. First of all, I would like you guys to understand about this, which is the reactive oxygen species. Okay, by watching the video link that I've attached here. What is actually reactive oxygen species and oxidative stress is? And how do this will come about in our body via exercise. Okay, you need to watch this video as this is also part of the teaching and learning and information that you need to know. And there's also important aspects from this video that will make you to understand better. So I would suggest you to watch this first before we proceed with the rest of the slides. So I'm gonna send the link in this video as well. Hyperlink. I'm gonna attach a hyperlink in this video, so you guys can just simply click the hyperlink, and then it will direct you straight away to the videos that I've mentioned here. Right. So endurance athletes engaged with heavy training programs have more tendency to get infection. This is due to reactive oxygen species that I've mentioned earlier that accumulate in the system of our body that could expose particular persons to have a certain tendency of infection. Okay, if the person's perform beyond of his or her body capacity limit, and however, regular exercise has been shown to decrease the incidence of wide range of reactive oxygen species associated diseases, for example, heart disease, type 2 diabetes, rheumatic arthritis. Alzheimer and Parkinson disease, and certain other cancers. So now we're going to look into acute effect of exercise on immune function. And before that, I'm going to explain to you the difference between acute and chronic effects of exercise on our immune function, because they will give you different effects in the body But first, let's discuss about how acute effect of exercise on immune system, on our immune function. The prolonged strenuous exercise has a temporarily depressed the effect of our immune function, and this has been associated with an increased incidence of infection. There's another link of a video that you can watch to get a better understanding how actually exercise to have an effect, acute type of exercise, which impacts on a person's immune function. So please do watch the video, as this is also, like previously mentioned, is part of the video. So there's also important information that you need to retrieve from the video that I might ask you in examination or test. So prolonged strenuous exercise has temporary depressive effect on our immune function, and this is where you can notice by the increased number of leukocyte, okay, mainly lymphocyte and neutrophil in your plasma after you perform following the acute bout of intense physical activities. And this increased number of leukocytes indicates infection, okay, in your body. And the magnitude of infection is positively correlated with the intensity and duration of exercise, meaning that the higher intensity that you do, the more number of leukocytes that you can observe in your blood plasma. Okay, I'm sure you have seen this graph before. This is where the risk of upper respiratory tract infection. Okay, upper respiratory tract means that from the nostril, okay, to your through your pharynx and larynx. Okay. So if you can see here, this upper respiratory tract infection against amount of intensity of exercise. Okay, there's a a U-shaped graph as shown here that says if you're sedentary, the risk of you having infected by bacteria or virus is reduced, not until you perform a moderate level where the turn point started to increase the risk of you having infection when the exercise is higher intensity performed. So that you will expose to more bacteria and viruses, okay? Or to have affected to certain diseases of our upper respiratory tract if the intensity is getting higher and higher. So please to keep in mind, this is only happen, okay, during the acute effect performing exercise. There are also increased the plasma concentration of various substances that are known to influence leukocyte function. Okay, this is including inflammatory and anti-inflammatory cytokines such as tumor necrosis, factor alpha, interleukin 1 beta, interleukin 6, interleukin 10, macrophage inhibitory protein 1, and interleukin 1 receptor antagonist, and also acute C reactive protein. These are all substances that could indicate a higher degree of infection. So I would suggest you guys to study, try to look into the information of these substances that I've mentioned above, and I hope you guys can relate them with exercise and infection rate. For example, IL-6, the interleukin 6, is released from the muscle fiber that acts as the defensive mechanism. It's a signal substance that released by the leukocyte, okay, due to certain infection happening within the muscles. So IL-6 is when the muscles infected by something, it will release by the leukocyte as a markers or signaling substances for leukocytes to surround the particular infected muscles or tissue. So, however, IL-6 production by T lymphocyte is inhibited after several hours of prolonged exercise. Apart from leukocyte, other hormonal changes also occur in response to acute exercise. So, for example, plasma adrenaline, cortisol, growth hormone, and also prolactin. So these are hormones that show to have immunomodulatory effect, okay, to your secretion of leukocyte in your body. For example, phagocytic neutrophils appears to be activated by an acute bout of exercise but shows diminished responsiveness to stimulation by bacterial lipopolysaccharide and induced oxidative burst, killing capacity after exercise, which can last for many hours. Acute exercise also temporarily increase the number of circulating natural killer or NK cell. Okay, but after exercise, the NK cell drop abruptly, less than half of the normal level. However, the normal value will restore back within 24 hours. So that is the reason why a person needs to keep on doing exercise, so the natural killer will keep on reducing below the normal level and adapt with that particular demand or situation. So I would suggest you to read more about natural killer cell or NK cell to get better understanding of this incidence. When exercise bout is strenuous and prolonged, usually more than 1.5 hours, the number of circulating lymphocytes will decrease below pre-exercise level for several hours, meaning that the NK cell will be there, and then also increase the number of lymphocytes as well. So following strenuous exercise, the production of immunoglobulin from B lymphocyte is inhibited. So hence, skin inflammatory response to antigen will diminish, meaning that the defensive mechanism of the skin will be lowered, and then easily for the particular persons to get infection through skin as well. Plasma glutamine also fall by 20% and remain depressed for some times. So plasma glutamine is also the defensive mechanism of our body to withstand any infection. So following a strenuous type of exercise, it will fall about 20% and remain depressed for a certain period of time. So yeah. So I hope by watching the previous video link I've mentioned above, you could also differentiate between T lymphocytes and B lymphocytes. Okay, what does T lymphocytes meant, okay, or function, and also what does B lymphocytes function is. Okay, that fits certain, purposes in your body. Okay, I hope you can get the answer from the video that I attached before. So in short, acute strenuous exercise appears to weaken the potential of the immune response to pathogen and will open the window of infection. Okay, now let's compare with chronic effect of exercise on our immune function. What will happen if you keep on doing the same exercise, although it's high intense, and how does it affects your immune function? So exercise itself, okay, exercise training, meaning you regularly perform it, also modifies immune function, with most changes on balance suggesting that overall decrease in immune function, particularly when training load is high. Okay, we have discussed this earlier. Circulating number of leukocytes are generally lower in athletes at rest compared to sedentary people. Okay, and why does this happen? Why does leukocyte number of resting leukocyte among athletes are much lower compared to sedentary people? Okay. Some weak evidence has shows that this could be because of the slightly elevated of the NK cells, the natural killer cells of body, is higher among trained athletes compared to sedentary people. But this is, again, as I mentioned, this is a weak argument, weak evidence. But the most reported reason why this occur among athletes, why leukocytes resting level among athletes is lower compared to sedentary people, is because of these three factors as I listed here. Okay, first is due to the hemodilution, meaning that the plasma in the person or in the athlete's circulation is greater. The volume is greater compared to sedentary people, and this will, of course, the dilute number per deciliter of the person, leukocyte per deciliter of the person is lesser compared to sedentary people. And also some strong evidence has shown that NK cell is less matured in well-trained population compared to sedentary. Meaning that when you're well-trained, you do exercise regularly, the natural killer cell is less matured. Okay, natural killer cell is actually the cells that kills other type of cells. Okay, and it acts like phagocyte. It will engulf. Okay, it will engulf other infected tissue or infected cells, and also probably tissue as well. And sometimes it could eat healthy tissue at the same time if it's too many NK cells in your body. And the NK cell for athletes has been shown to be less matured compared to a trained population. Compared to a sedentary population. And also, phagocytes and oxidative burst activities of stimulated neutrophil also has been shown to be lower. Okay, this is very much related to the previous NK cells mentioned. So the phagocyte, okay, the eating behavior of the leukocyte, the phagocyte, okay, and oxidative burst activities stimulated neutrophil a lower among athletes compared to sedentary people. Okay. The level of secretory immunoglobulin A are lower in well-trained athletes that engage with heavy training, as their T lymphocyte rate of helper over suppressor ratio is lower. Okay, defensive mechanism of the immune system of the plasma or the tendency of the body plasma to get infection is lower when you regularly perform exercise. Hence, with chronic period of training, you will adapt your body to certain changes and make it more adaptable to that particular body demand. Hence, the acute effect of performing high intensity exercise or any type of certain intensity of exercise will diminish and replace with benefit by increasing the immune system. Okay, after at least 7 days of regularly perform the exercise and that particular exercise intensity. So the take-home message is, okay, the take-home information here is, at first, when you perform exercise, you will expose to certain kind of mortality, and throughout time, your body will adapt to that particular demand and increase its immune system, and your body defensive mechanism will be better compared to the previous stage. Okay. I'm sure you have seen this graph. Okay, I will show you. Okay, it's basically when you perform a regular exercise. Okay, you perform exercise regularly. Okay, and first, okay, so let's say this is time. Okay, let's say this is we'll say I would say I will put this immortality. Yeah, of course, it's not. It's logic. I hope you guys understand. It's not actually immortal, but you know, your body, immune system. I would say, yeah, maybe immune system. Immune system. Okay. So when you start to perform exercise, okay, at first, okay, I'll add this time of doing frequency of frequency of training. Okay, so over time, so frequency of training over time. So at first, okay, if you're sedentary, it will increase. Okay, when you perform exercise, let's say this is where you perform exercise. Okay, this is where you perform the exercise. Okay. Let's say this is exercise. First part. One. Okay, let's say this is exercise part 1. Okay, I'm just going to put it here first. Okay, and then okay. Exercise about, I'm going to erase that later. About 2, about 3, then about 4. Okay, we'll take this as an example. Okay. About 1, about 2, about 3, about 4. Okay, then this is the frequency. And then when the person performs exercise and has passed through exercise part 1, your immune system will reduce a bit. However, post recovery, it will increase back and then sustain at that particular point. And then when the guy or the person perform exercise part 2, of course, the immune system will be reduced a bit, but after certain several hours or some period of time, it will increase better compared to the previous state, and then maintain. Okay, same goes when the person experiences after performing exercise part 3, and then the process continue if the guys who to perform exercise part 4. So keep it on increasing. So this is how it works. So after several hours of performing exercise bout, you're exposing yourself to a certain degree of mortality, or however it will increase. Okay, afterwards, and then continue increasing right after you perform the subsequent exercise bout. Okay, so this is, I'm sure you have seen this graph. So this is the principle of exercise. Of although it's kind of exposing your body to, to have a certain degree of infection or mortality, of course, it's going to become better and better. So you keep on doing, increase the frequency of exercise that you are doing. So yeah, and I also would like to remind you guys to watch the video that I attach in here. Okay, so have a better understanding of how immune system will affect on acute and also chronic type of exercise. And for that, thank you very much. Bye.